We found out when we were about 8 weeks along. We were surprised, but we were excited. We weren't completely shocked because twins run in our family. When I was 25 weeks pregnant, my water broke. I was actually home. It was the middle of the night. I didn't really think it was my water breaking. So I went to work the next day and I called my doctor. And since I work at St. Luke's, I was already at the hospital, and he had me go up to labor and delivery, and where he met with me, where he told me, you know, my water had definitely broke. So from there, I was taken by ambulance to Crouse, where I was there for almost 2.5 weeks. At 27 weeks, I delivered Graham and Kamryn. Kamryn was 2 pounds 6 ounces. Graham was 2 pounds 1 ounce. They had the normal preemie type issues. They couldn't really breathe on their own. They needed supplemental oxygen. They really weren't even ready to eat. The main issues were lung development, oxygen flow. One of the other things was their eyes. Within a couple days of them being born, they had the eye doctor that came into the NICU who constantly was checking their eyes to make sure their vision was okay. They were in Syracuse for close to 2 months, and then we finally were able to get transferred to St. Luke's. They were taken in an isolette, and actually it was the first time they had actually been together because since they had been born, they had been in separate nurseries in the NICU.
This piece of equipment is our neonatal transport isolette. We use this piece of equipment to bring babies back from Syracuse. And the reason we have two is lots of times when babies are preemies, they're twins, so we'll bring twins back, and we actually used this exact set for Kamryn and Graham Harter. At this point, we cannot get replacement parts for it, so we're in dire need of buying a new one. And the technology has improved so much that these are almost outdated. So we're looking to purchase another transport isolette to replace this one.
When they got there, I left work and met them and was able to hold them both at the same time, and which we hadn't done previously, so that was pretty neat.
Our main goal while we were at St. Luke's was they needed to grow. They needed to learn to eat. As preemies, they need to learn to suck, swallow, and breathe at the same time, and that's something that they hadn't learned because of being premature. The staff was great. They treated my kids like they were their kids. Yeah. Kamryn came home New Year's Eve night.
I remember, yep, because it snowed.
It was,
and it was terrifying, that drive home, that first drive in the car.
One of the benefits of being at Faxton St. Luke's was that since we had Kamryn home and Graham was still in the hospital, it was 10 minutes down the road as opposed to an hour. Graham came home about 2 weeks after Kamryn came home. Being that Faxton St. Luke's is a level 2 nursery, it made it possible that we could bring them home and have them closer to home 4 to 6 weeks earlier than we would have if we were out at Crouse still. It was important for us to share our story because we were so affected by Children's Miracle Network. Without their support, we wouldn't have been able to come home and have the babies come home with us as well. The money stays local, so you're helping your community, you're helping your neighbors who possibly might need to utilize the services at Faxton St. Luke's Healthcare.